Hope everybody's been enjoying the NIC conference. I think it's been a really successful one. So nice to be able to get together in person and see everybody's faces. It's been a challenging time for all of us. And so I'm really excited to be here and glad you all joined us for our session this morning. So we're going to be talking about the solving for the forgotten middle market. My name is Joe Kiernan. I will be your moderator for this morning's session. I'm joined by a great panel. Just a little bit about me. I am the Chief Strategy Officer and Senior Vice President of Network Development for a company called Ocean Healthcare, operating a post-acute healthcare system in mostly in New Jersey, with hospices in New Jersey, Pennsylvania, Michigan, and Ohio, as well as an array of other post-acute and seniors housing services and locations. I'm joined by a great panel this morning. We have Pilar Carvajal, the founder and CEO of Innovation Senior Living. Also Tana Gale, president of Merrill Gardens and Truewood by Merrill. And we also have Ryan Brooks, senior principal here at NIC for healthcare. Welcome. Thank you, guys.
Thank you.
All right, so again, welcome everybody. We are going to be talking about, again, the forgotten middle market. Would like to just have our panel just introduce themselves, tell a little bit about their organizations and what they do, and then we'll get into the meat of this and start off with some really great data and demographics. So Pilar?
Sure. Hi, my name is Pilar Carvajal. I'm the CEO and founder of Innovation Senior Living. We're an owner-operator out of Florida and operating middle market senior living properties.
My name is Tana Gale. I'm the president of Merrill Gardens. We're based in Seattle, but we have 70 communities across 20 states. Of those 70 communities, 23 are Truewood by Merrill, which is our moderately priced product that we'll talk about today.
And I'm Ryan Brooks. I'm one of the senior principals at NIC with a focus on healthcare collaboration.
Excellent, thank you. So the senior market has changed, and the seniors housing segment has changed dramatically and provided both opportunities and challenges for us all. Meeting the needs and expectations of today's seniors, as well as creating value for owners and investors, has been vital for our industry and continues to be an opportunity everywhere we turn. One of those opportunities, which is capturing a lot of attention, is the middle market. It is really being referred to as sort of an emerging market, but also has been coined, the phrase has been coined actually by NIC through a grant that was issued and a study that was conducted in 2019, referring to it as the forgotten middle. And we're going to see why when we get through some of our demographics and our data. So there's a lot of opportunity in this segment of the market, both in development, acquisitions. We're going to talk about repurposing as well, and also looking at the real revenue opportunities that are in front of us today and as we move down the road. So let's get started, and I think I'm going to turn to Ryan and get through some of our data and demographics to really understand the depth and breadth of this market.
Thank you, Joe. Let me just start by saying really appreciate you moderating today's discussion. I want to set the table a bit for our audience and try to provide some background information to kick us off. So in 2019, NIC sought to gain a better sense of the income, care needs, and demographics of the future senior housing resident. And in that vein, NIC issued an RFP that was ultimately won by NORC at the University of Chicago. And NIC provided NORC a grant to conduct this first of its kind study. And going into the study, NIC understood that there's a senior population cohort on the upper end of the financial spectrum who can afford the current private pay seniors housing and whose care needs are being met by the private sector. On the opposite end of the wealth spectrum, public assistance and government subsidies exist to help with that cohort. But NIC's study focused on the population between these two groups, those who had too much wealth to qualify for government assistance, but not enough wealth to afford the current product on the market. In this study, it looked at financial wherewithal, but not just income. It also included home equity and retirement savings, and then matrixed this information by healthcare needs. And this provided investors, operators, and policymakers with foundational information to make strategic decisions on the issues associated with the middle market. And the hope was this study would create a dialogue around potential solutions in senior housing and care that address both the need and the opportunity of this cohort. In the months following the study's publication, the study prompted both a Health Affairs sponsored policy forum in Washington, D.C., as well as a middle market investor summit in New York. In addition to these summits and forums, each NIC conference since the study's publication has had at least one session focused on the middle market. In the fall of 2019, there was a session focused on financing the real estate for the middle market. And in the spring of 2020, there was a session focused on addressing the healthcare needs of this cohort, since we know that this is one of the most complex, labor-intensive, and ultimately expensive aspects of this proposition. And to accomplish this, there are a few strategies out there that operators have relied on. Some operators have turned to creating their own branded I-SNP or Medicare Advantage plan. Others have partnered with physician groups to deliver care directly at their properties. But one thing is clear, in the time since the study's publication, as evidenced by these headlines behind me, there has been a lot of investor and operator interest in the middle market. Now, more recently, some of this may have been spurred by COVID-19's disruption of the senior housing and care sector at large, but a number of operators and capital providers have really started to embrace this concept. So we know there's growing interest in this sector, but what is it about middle-income seniors that makes them the forgotten middle? Well, there's been a variety of generational shifts that impact seniors' housing needs in the next decade. And first, when we look at retirement savings, we know that pensions and defined benefit plans have become less common, and they've been replaced by 401ks and other defined contribution plans. And as a result, future seniors have lower overall savings than prior generations. And compounding this challenge is that future seniors are also less likely to be married. Having spousal support enables many people to stay in their home longer and means assets and financial resources remain pooled together. Today, 62% of seniors are married, but that number drops to 52% for future seniors. And the utilization of family caregivers is an option regardless of income status. But keep in mind that people are having fewer children, and those children are less likely to live nearby. So practically speaking, this solution is becoming harder and harder to make a reality. As a result, the options available to middle-income seniors are limited. Their options typically have either been to rely on family and unpaid caregivers, or they must spend down their assets until they become eligible for Medicaid. So now that we've defined the population, let's quantify it. As of 2014, there were about 20 million seniors aged 75 or older, and 7.9 million of these are considered middle income. And by 2029, that number will increase to 14.4 million, accounting for 43% of all seniors. So we've defined the middle market and we've quantified the middle market. Let's now cover some of the health characteristics of the segment. When we look at the 14.4 million seniors aged 75 or older in 2029, a few health characteristics really stand out. 8% of this group will have some form of cognitive impairment. 60% will have mobility limitations. And 20% will be considered high needs defined as having 3 or more chronic conditions and 1 or more functional limitation. And also keep in mind that the 75 to 85 age group brings these numbers down. And if this group was just 85 and older, the percentages would be much higher. So where does that leave us? How many of these 14.4 million seniors can afford the current cost of senior housing? Well, with the annual out-of-pocket price point of assisted living at $60,000, which is the current average, 6.6 million of those seniors would have the financial resources available to afford it. And this is with housing equity, by the way. And as that price point goes up, the potential market size shrinks. And as that price point goes down, the potential market size expands. But achieving these lower price points is no easy feat. One of the biggest challenges that operators and investors need to decipher is how to manage the healthcare components of the forgotten middle. Some operators are turning to Medicare Advantage plans or operator-owned I-SNPs, which are a specific type of Medicare Advantage plan available to beneficiaries who fall into a certain special needs demographic. And the upside of Medicare Advantage plans are that they often provide more benefits to residents than they could receive under traditional Medicare. And the plans offer care coordination among different healthcare providers. The downside is that operators are taking on at least partial risk for their residents' health. And for I-SNPs specifically, the upside potential is that there can be high overpayments for plans serving the sickest beneficiaries. A Kaiser Family Foundation study from 2019 found that potential overpayments increase as the number of chronic conditions goes up. The average overpayment for beneficiaries with no chronic illness was about $225, but the potential overpayment jumps to over $1,600 among the beneficiaries with 5 or more chronic conditions. Another option on the table for delivering care to residents is to partner with a dedicated physician group. And doing this can deliver enhanced clinical value to residents. It has the potential for some great clinical process improvement, and operators maintain a sense of control over their care delivery. The new breed of primary care providers leverage value-based payment relationships and often have a strong technology backbone as well. The downside is you're more limited in physician selection. So I really hope that helps set the table a bit for our upcoming discussion. We've got some great panelists here on the stage that have a lot to contribute to this conversation. So without further ado, I'd like to turn it back over to Joe, who can continue.
Ryan, thank you so much. Excellent. Yeah, when we went through the slides, it was such an eye-opener to see where the opportunity really is and just how much opportunity there was. I don't think we really realized until that study was conducted and really had the data and the numbers to be able to show it. So Tana and Pilar, I cannot thank you enough for coming today and being open to sharing your experience and how you're handling this. You've both done a great job with it, and I think our audience is going to learn a lot. So let's get into your business models. So you can kind of take us through what your individual business models look like. And as we learned from Ryan, there's multiple income sources. And how do you balance those as a middle market operator? And what's your approach been so far?
Okay, I'll go first.
Tana?
Well, I have about 20 years of experience serving low-income seniors. So my experience started with licensing the very first public housing building into assisted living in Miami, Florida. It became a state model that I took to 23 states and assisted other public housing and subsidized housing providers to replicate the model. But what I learned in serving low-income seniors is that middle-income senior was very attracted to that model. And many times I was changing the percentages in my building from low-income seniors to middle-income seniors and serving them. And I think the winning combination for that population was that we had a standard property. There was no bells and whistles in the property, but we served them with great service. We had partnerships that we brought to the table that helped us make our program really robust, but wasn't necessarily part of my payroll. And I think to some of the points that you were mentioning before, the partnerships, I think, are key to this type of a model. We use universal workers. We have streamlined operations, very strict expense control, very different to what's currently in the market today in terms of that higher income individual. So we've just parlayed the experience on the affordable side to cater to that middle income senior. And we're looking to develop a portfolio through acquisitions of older properties. But I have converted trailer parks into assisted living, hotels, multifamily. I don't see a barrier to services. I see that by licensing a building, you enable that person to age in place and receive the services where they live, whether they have appropriate income or not. So we've done rental subsidies, service subsidies through Medicaid, just always thought very creatively about that individual and how to serve them.
So Pilar, let me just follow up by asking, so when we look at the lower income middle market, the middle portion and the higher end, kind of that spread, do you tend to lean more towards one versus another, or are your operations really spread out over all three?
So my experience has been on the low income side.
Okay.
So I've become an expert on how to subsidize that individual so that they can pay for their services.
Stretching those dollars
right?
out even further.
But the opportunity, I was so thankful to Nick and their Forgotten Middle study, because when I came to the Nick conference the first time, I think people looked at me like I had two heads. Like, what are you doing? And now this further validates my thesis, which was this is an enormous market. I just tipped, just kind of hit the tip of it. But there's an enormous opportunity here. But yes, the model that we're looking to replicate will be a private pay, middle income senior that is able to spend down to Medicaid, because that's my experience,
Right.
And not have to give them that 45-day notice once they've spent down.
Right. Excellent, thank you. Tana, tell us a little bit about your approach.
So I'm on the other end. So 27 years ago, I got into this business serving more the higher end affluent senior in our retirement communities. And so what we're going to be doing, or what we are doing now in 23 of our communities, is really servicing the middle market through taking communities that were developed. I think the average age of our Truewood building is about 26 years old. They're a little bit older buildings. When they were built 26 years ago, they were the high-end product in the market. And they're still very relevant. But new shiny pennies are being built, and what we saw was an opportunity to acquire these buildings at a good basis and be able to service a more affordable product. And what I find interesting is you look at Ryan's numbers of how big that number is. The number's even bigger when you think about when we were doing our focus groups and trying to figure out who exactly are going to be these people that move in. It's the very practical senior too. Mm-hmm. It's the one who maybe wants to leave something to their family someday. They don't necessarily want the bells and whistles. And there's a lot of them out there too. So it just takes that number Ryan showed us and makes it even bigger. Mm-hmm. So the bulk of our product is great retirement communities. They were mostly all purpose-built retirement communities. We're just changing the operating platform on how we do it.
That's great, excellent. Ryan.
Joe, if I could add to Tana's point here, the numbers I had up there showed seniors in 2029, but because of data limitations, we were only able to project to that point. So beyond that, the numbers get even bigger.
Yeah, and I think to the point of the study and what you brought up earlier also, when you take out the younger age group, the percentage is going to go up much higher because we're seeing more and more of those seniors staying at home with home-based services, and that's been conversations of several past NIC conferences of looking at the aging at home, but look at pushing towards that larger number with older, more needy seniors.
But I think some of that aging at home issue that we have is because this middle income senior goes to the properties that exist today and doesn't see a home for themselves there.
Right.
So
That's a great point. Okay, so let's dive into some of the operational considerations that need to be in place in order to successfully run a middle market property. So, looking at the services for middle market seniors, I would venture to say that there needs to be a balance of services, support services, amenities that need to be addressed. Can you take us through some comparisons, especially looking at more of a traditional AL approach, AL-IL approach, to the models that you're both operating, and what did you need to take into consideration in order to make it effective?
I'll take a stab at that. First, one of the things that we did is we sat down and we did focus groups. Instead of me guessing what was important to people, I actually sat down with family members and with seniors and asked them what was important. If you take a traditional retirement community with all the bells and whistles of that list, what was a must-have? The other thing that happened was some focus groups happened from Washington State University. They did some focus groups for us as well, which gave us a lot of great information about what was important to people. And the one thing that I will keep saying over and over is quality was never going to be compromised. This wasn't a quality issue. It wasn't like they were going to get different food. They were going to get great food. It was just going to be delivered in a different way. So for us, it was paring those things down of what was going to be offered. And then at the end of the day, it's labor is a huge part of it. And so finding out how you deliver 3 meals a day and assisted living services and programs and activities by not spending all of your money in labor. So that was a huge part of it.
I would echo that thought. Obviously, the largest part of your expense is payroll. So looking to economize with that staff and we both do the same thing, that universal worker. So I don't hire servers and dishwashers and all these typical types of roles. I have that one employee that does everything for that resident. And we find that there's better care because that employee sees that individual through their entire day, what they're eating, how they're sleeping, how they're bathing, and so forth. So it's been a very by accident type of a thing for me to realize that this is actually a very effective way to operate that middle income product.
And labor's a big part of it, but we also look at every single line item in the budget.
Indeed.
So, because you're looking at everything, and so it goes down to what your uniforms look like, and all of it. It's scrutinizing every single expense that you've got.
And no chefs on the payroll, right? It's cooks and meat and potatoes. You've got chefs. Okay.
To Pilar's universal worker, and one word that she's used a lot, you'll hear me use a lot, is partnership. It really is what makes it work. So we have a universal worker as well. It's called a resident relationship partner, resident experience partner. And that is, we've had such great success with that. So one of the challenges I've had is that we were operating traditional retirement communities when we rolled this out. So I already had people living with us and people working with us as we were rolling out this new operating model. So one of the things we did is we said to all of our current employees, we're in this labor crunch anyway. And so we said, we've got a new opportunity for you. It's this new job description, and we'd really like you to consider it. And so we have taken a lot of the folks that already worked for us, maybe as a housekeeper, a server, a dishwasher, and now they have more. We train them to do more things. When they get trained to do more things, we pay them more because they're more valuable to me. And that has been wildly successful. We've got a housekeeper in Bradenton, Florida, who had been a great housekeeper for us for years, and gave her this opportunity. And she said, I really want to get into caregiving. Gave her that opportunity, and she's on a career path now to probably become a nurse. And if we hadn't thrown that out to this housekeeper, I don't know if she ever knew that that's where she would probably end up someday. And those stories go on and on. So that's been a real benefit to us on the labor side, is our rep.
I would say something additionally in our model is we don't have nurses on our payroll. So we look to staff through med techs and CNAs. So I operate in Florida where the med techs can do quite a bit. So that's a way that we also save on our payroll. The nursing services that we do provide are third-partied out. So we look to bring that medical component to the services that we offer through third parties, home health, bringing an array of physicians into the facilities to serve everything from general practice medicine to podiatry and dentistry and dermatology. So it works really well.
You guys are doing great. This is something, who's going right into that question? No, that's great information. And so with regard to the staffing, because that can make or break any operation. And it was something, Tana, that you had said earlier about you were not going to sacrifice quality. And you mentioned that relative to food and food delivery. But on the staffing side, so you've taken the approach where Pilar was just talking about, really partnering versus hiring. What's been the success level with that? And do you go after particular types of third-party providers? Is there sort of a secret sauce to that process?
You or me?
Really more so for Pilar.
Oh, for me?
Yeah.
Okay. I think we try to, we go very local. So I see my properties as like little ecosystems upon themselves. So we will branch out wherever we operate and see who are the doctors in that area that would work out well, who are the home health companies. To some degree, we will look to a third-party provider that we can use across the properties. We tried like the pharmacy, for example, or the therapy company, but we've really gotten down to using more local providers.
Has that helped, I'm sorry to interrupt you, but
Sure.
Has that helped drive your occupancy in any way with those local relationships from a referral perspective?
Indeed, that's exactly why we do it.
Creating that network, that's
Yes.
great.
And I would say the same. We do, I think all of our assisted living communities have nurses on staff, but outside of that, it's the very same. We keep it very localized with who we partner with. We go so far outside of just the care side, but it's back to the partnership thing. Part of the move-in paperwork with us is a form. It's called True Would, Sure Could. And we have a resident fill it out, maybe with their families, and we ask them, we let them know up front, this relationship we have with you living with us is going to be about service. And what service do you provide or could you provide? And what would your family like to do for us? And so that gets it very individualized because everybody's going to be a little bit different. But that's really fun. You get to know, we have a resident who was a college professor. She teaches writing classes in our community. We have, it's all those relationships. Like we have a bunch of relationships with Trader Joe's. So they bring their flowers over at us at the end of their time. And it's an activity. Our residents put the flowers together for the dining room. The craft store, you tell them what you're doing, and it's amazing what they will donate to you. So that partnership it's with care, it's with activities, it's with transportation, it's with all of it.
And I think to your point, just to piggyback off of what you said, because we're developing this new model, I think the answers are in the residents and the families. And so that's been my practice, is to meet with my residents and my families and say, what do you want? What do you want me to provide here? And that's why these I have different services here based on what the resident population wants versus here. And they tell you the answers. So there's a hint.
That's great. So when listening to what Ryan had presented earlier with regard to the significant numbers of seniors that are looking for this and that are going to need this, he also pointed out the level of care and need and acuity. So I want to throw it out for you, for both of you. When does acuity become too costly? And what have you done, or what are you doing, and are even preparing for, relative to managing that acuity and still staying in that middle market cost structure?
Well, unfortunately, I don't think we can be everything to everybody.
Right.
So there is a point where, at least for us, we are not going to be doing a lot of memory care in order to keep it affordable. So most of our products are just going to be standalone assisted living. I'm accustomed to the clinical model, having served the low-income senior. When the low-income senior shows up, they're in pretty bad shape, and they're not looking for luxury, resort living, hospitality. They're looking for, how can you help me? So it's been, I think that experience has just helped me develop the model towards more of a clinical model, partnering again with those third parties that can help us, including hospice. If we can, our residents obviously can pass away in our buildings. But there's a point where we can't offer the service. We cannot have them in the buildings anymore, and we do have to look to our nursing homes and so forth to further the cause.
Okay. Tana?
It's very similar. Our acuity will probably be lower than it was traditionally in some of these communities. I'm sure many of you have had experience with them. When they're older communities, they tended to kind of attract the more high acuity resident. And we are kind of reversing that a bit, and that comes from that assessment when they move in and being clear of what we can and can't do for them. And I think it's really fair because they're also looking at the price they're going to pay. I feel like I kind of came from the sales side on the high end, and I would sit in my meetings and tell them all the things we were going to do because I was trying to justify $7,000 a month. It's different when you're talking about $3,000, $3,500 a month. So we're pretty clear up front that we're probably not going to be doing two-person transfers. We're probably not going to be doing a lot of diabetic care. There's some things that we can't do. But back to the partnership, we will make sure that we have a partner in, maybe a higher acuity assisted living building or skilled nursing in our markets to make sure people are getting taken care of, but they might not be for us. Like you said, we can't be everything to everyone. There's a very large population of people that we can take care of.
Right. So when we were putting our this topic and our panel together, we were just starting to feel and see the impact of the current staffing challenges that I think every owner-operator is faced with across the country, and some markets more than others. How are you guys dealing with that currently? And looking forward, how do you see this? How do you see yourselves managing what clearly is a real issue for everyone right now?
Well, there's no silver bullet to it. I'm not going to sit up here and tell you, oh, here's exactly what we're doing. It's a challenge in 100% of my communities, whether you're the moderately priced forgotten middle or our high end. Staffing is an issue. What we found, I'll go back to that Truewood rep position, has been very successful for us in what we thought it would be. They're more valuable to me, but job satisfaction is a big part. I think we get it stuck in our head that it's all about money. They want to go make $2 an hour more somewhere else. I still think there's something about needing to be appreciated, understood, and the folks that are in this rep position doing different things, their job satisfaction has just been just off the charts, and I didn't expect that. So I'm hoping that we see less turnover with the Truewood rep position. That's what we're working really hard on right now. We took one community, and this is not a silver bullet, it's kind of basics, but it's been interesting to watch. So last April, we took a community and we raised their caregiver wages pretty significantly, but very structured. So someone with a little bit of experience, medial experience, a lot of experience, there's a scale there, and we tracked it very carefully. And we told them, you are now the highest paid caregivers in this little micro market. And this is what that's going to mean to you. We're going to be happy to pay you this, but it's really important that we see you dedicated to our company. So people who had second jobs stopped their second job. They committed just to us. And I think, and so that started in April. Since then, we've only lost 2 caregivers. One, because we wanted to. Some turnover's not bad. The other went back to school. So when we looked at that, like, why is it being so successful? I think the key to it is that a part of this kind of contract with them is that every month their supervisor sits down with them and says, how is this working for you? Are we meeting your expectation as a caregiver for us? And it gives them the opportunity to not wait for an annual review, to not wait for, they're getting this kind of direct feedback real quickly. And so, I hope that's not an anomaly. We can roll this out in our other communities, but it's really been, had a big impact on that community. Additionally, the families love it. They don't want turnover. They like their caregiver they've got. And so we've got families kind of backing us on that too.
I think sometimes we as operators, we jump right to well, let's raise rates and put some more ads out and hire more people, but really balancing that out and starting off with retention, closing the back door. I love the idea of actually having those more intermediate conversations where you're not getting surprised by an employee who's clearly not happy, and which is going to affect care, operations, and then ultimately you're going to have a job opening.
Yep.
So great approach.
Think about the fact that we're having to increase hourly rates. With the universal worker and adding more responsibilities, it's a perfect match. So sure, we're going to pay you more, but we're going to give you these additional responsibilities. And so that's how we've been able to make that position really strong and attractive for new hires. I think at the same time for us, at least one of my angles when I'm looking to hire talent is, this type of product, it feels good. Okay, so many people in the industry working at it from ground level all the way up to your sales and your executive directors are serving a population that doesn't maybe feel like what they know is really going on out there. So I've been able to attract really great talent just because of the I guess social impact that this type of property can give to an employee. And I think in light of what we're dealing with staffing and the great resignation and people looking for purpose, this is a purpose-filled opportunity for these employees.
That's the fourth time I've heard something like that during the conference. So it was one of the sessions yesterday I was sitting in, and it was really interesting to hear that because of the pandemic and the shift in what people are doing for a living, there was an example given by one of the co-moderators and one of our folks on the planning committee, that it was a bartender who had worked at a bar, and she was also working part-time at the community, and decided she just wants to stay and work the community in the assisted living. She was getting more out of it personally. Like you said, it felt good. She felt like it was a better place to work. And because the restaurant had been closed down and shut down for so long, she just felt like that was where she wanted to put her.
How many of us know, my grandmother, there's a lot of people in my family that are working class, middle class individuals. So when you can serve that population in a meaningful way, that gives that employee that purpose to want to come to work.
Excellent. I just also want to remind everybody, if you have questions or anything, please, you could post them right through the app. Ryan is going to be monitoring our questions, and we're going to make sure that we have enough time later on to answer some of those questions for you. So, all right, let's talk real estate. So traditionally, we build or buy, right? Acquire or start some new construction. So as a result of the pandemic and some changes within the market, there's been some opportunities that have come up for, I think mostly in the seniors housing space, but in a lot of different industries, and looking at repurposing. So repurposing properties that may have failed as a result of everything we've been through for the past, 20-something months now, going on 2 years. So can you tell us your opinions on repurposing, and also, have you done this? I know the answer to the question, but for our audience, have you done this, and how has that worked out for you? So, Pilar, you want to start?
I've done a
pro at
ton
this.
of it.
Yeah, well, when you told me about the trailer park, that was...
I've done a trailer park converted into assisted living. Like I said before, multifamily, high rises, scattered sites. Again, I don't see a barrier to providing services. Let's see what you have. And I think that's why I called my company Innovation Senior Living, because I've always thought very innovatively on where can I put services, but also on the demographic that I serve. So I think it's all possible. Hotel conversions are hot out there, taking something, and what I've successfully done as well is take a value add senior living opportunity, and just by serving a different demographic, be it a lower income individual or a middle income individual, I'm able to fill the occupancy on a building that maybe wasn't performing, serving a higher income individual.
So can you just give us an example of like maybe what was your most successful repurpose project?
I've had several.
Your favorite, maybe?
I think I proved the point that a working and a middle class individual can live very happily together, as well as independent living. So I've done conversions of independent living where a portion of the building is assisted living, and then allow those independent living seniors to age in place and bring the license to them when they need it, but also create like a service-enriched housing model. So you can live independently, and if you need home health, I got that. If you need meals, I got that. And if you need to move into the assisted living, that's right downstairs.
Right. And we've been talking about that for quite a while now with, independent living with supportive services. You really can't, healthcare has clearly come into seniors housing, and I don't think you can separate the two. It's not just a real estate play any longer. It really is that service model.
Well, you can't use Medicaid unless you're licensed.
Right.
So then what we do is the home health brings in those services through their billings.
But you can, if you're hitting that target middle market, yet again,
That's right.
where that real high private pay piece is a smaller percentage, that middle market growing, especially by 2029, that number, the 43% blew me away. I mean, that's, we're not that far away from half of the population. So, Tana, how about for you?
As I mentioned at the beginning, most of our Truewood model was actually purpose-built retirement communities, but 25 or 30 years ago. Through my days, I've converted a lot of hotels, a hospital once. I see the future in, when the travel hotel or the extended stay hotel was being developed like crazy. I think that's definitely something we could look into. We should always keep our eye out for that. Because that's kind of got everything we need. Because I don't think, to keep it the price point we want, I haven't been able to see how you can develop it from the ground up. I don't think you need to.
Yeah.
I agree. I don't think you need to either, but there will be a day when that's all figured out.
Yeah, and I think again, just really where taking advantage of obviously the tragedy that was the pandemic, but seeing all of these boarded up or closed up, restaurants and stores is tough, and I'm hoping everybody's recovering well. But certainly, I think one of the interesting things was looking at the hotel industry and some of those low to moderate priced hotel options where they just failed during the pandemic, did not have the cash to be able to stay open, and repurposing those like a Hampton Inn and Suites or some of the travel hotels is seeing a lot of those
And I
being
think that's what
converted
we're
over.
essentially doing here is just like the hotel industry. Our industry has a lot of Ritz-Carltons.
Yep.
I've developed a couple of the Econo Lodges. But what we want to do here is the Courtyard Marriott.
Yeah.
Right.
Right? And replicate that repeatedly. And this demographic is inexhaustible. I mean, it's huge.
Yeah. Okay. So all of that takes what? Capital and money, right? So let's talk about your investors. What type of investor do you either work with, or do you tend to, or what type of investor would be interested in a middle market operation, a middle market portfolio? Take us through that, and then who of you tend to work with does that differ significantly from a more traditional seniors housing operation?
I don't think it really differs very much. I see it as an investor who wants to diversify what they've got. So I work with Renew REIT, and they're people that are, number one, driven by a mission, because it is not all about the returns. It can't all be about the returns because the margins are not like they are in the traditional product. So they have to see the mission in it, and it's an investor who wants to be in it for the long run. This is not an overnight thing, but once you get full and you're kind of moving along, Ryan's information will show you they are going to stay full. They're going to be the product that will weather most storms. I try not to think back to 2008, but every once in a while I do. I think about the recession. And the company I was operating for at the time, we had an upscale model and we had kind of more of our traditional model that was similar to the Truwood by Merrill. And when I think back, that was, during the recession, it pretty much stayed full. It dropped down a little bit, but it didn't have the big swings that we saw in our more upscale model. And so that's what I think this is going to be too. It's for the person who sees the long-term returns on it that will help us, make good decisions along the way. And I'll go back to the word. And they're good partners. They're just really good partners to work with.
That's great.
I would agree with what Tana's saying. It's definitely a diversification play, but I think it's also, I am partnering with people that are outside of the industry as well, looking to get in, and this is a way to get in. As well as I'm investigating social impact, people that really want to look at this idea of a profitable business, but that has a social impact as well. So looking at all kinds of things.
Yep.
That's great. Okay. So we've talked about the real estate, the investors, our staffing. In terms of, and really, Tana, you touched on it in terms of managing investor expectations, really looking at that at the margin, and it's not going to be what we would traditionally see, but much more of a long-term investment. So you kind of helped us round that out very nicely. We talked about the meals and the services. When you're looking at that, is there a particular balance that you create when we go back to services of expectation versus what you're actually able to provide? How do you create that balance of not having the multiple restaurants or the restaurant style plus the cafe plus this plus that?
I think it's managing expectations and providing a great product. So in a traditional Merrill Gardens community, we have anytime dining. So from 7 to 7, you can come into our restaurants and you can order off the menu whatever you would like. What's different at Truwood by Merrill is we have dining hours, and we are really looking at the labor portion. So our breakfast may look more like a Courtyard by Marriott, a Hampton Inn, where you would go down as a business traveler and pick up your breakfast. And so we always have a hot option. We always have pastries and protein and oatmeal and things like that, but it's not necessarily the made to order. So today we might be serving scrambled eggs, and so if you ask for an omelet, we might not have that. We are very dedicated to one meal, and in most of our communities, they've selected the noon meal to be more traditional, where they get a menu, they order off the menu, it is made to order, it is taken by a server, it's whatever they would like. And we see that more as, yes, that meal is important, but that socialization, that getting out and being social is important to them too. And then dinner is more of a lighter dinner, and that was, again, directed by the research that we've done through focus groups. So it is, again, taken with fewer staff to take care of people, but still, like our PRD for food didn't really change. Where we really tried to make the adjustment is in the labor, because we still felt like they deserve a great product, no matter how we're delivering it. So it's worked out well for us. Not without its hitches along the way, to go out and tell people. There was one benefit from COVID, and that was we were serving all of our meals 3 times a day from a cart into an apartment. And so when we rolled out Truwood, we were actually bringing people back down to the dining room, and so that helped us a little bit. Change has been a challenge,
Yeah.
but it works out well for us.
And I would say, there's no bells and whistles in our meal delivery. It's meat and potatoes, it's, meal times, lighter meal at night, and special occasion dining. So for Thanksgiving and Christmas and so forth, that's when we'll really splurge. But most of the time, it's just basic dining.
Well, and when we were, planning for our session, one of the conversations we had is, your clientele and your residents, they don't want that. They're not. Look, they're saying, you're spending my money. I want my money to last longer. I want to be able to stay here as long as I can, and so they're looking for that economy
That's exactly
as
right.
opposed to what they might feel is like wasting money.
That's right.
Okay, sort of
They're
like,
not interested in it. It's a turnoff,
Yeah.
actually. So they want something that's very standard, basic, right up their alley, nothing fancy, but that does the trick.
So I want to talk about again. We've touched on the partnering piece of it, and then we're going to jump to some questions because we're getting a little low on time. But have you considered or have you done? I know within my organization, we have so many different, we have 9 different service lines on top of looking at our skilled nursing and our assisted living portfolio, our behavioral health hospitals, so hospice, home health, private duty, outpatient. So I can service a significant amount of my own patient and resident population, which is why we refer to our organization as a network, because it is a network of locations and services. Have you considered or have you gone into the business of owning your services so that you are really creating multiple revenue sources from one payer?
Yes, that's my next step,
Okay.
at least on the home health side.
My answer is not yet.
Not yet. Okay. Well, maybe I can
Next year.
help you out with that.
Okay.
I'm calling you tomorrow.
There you go. Okay, and it works well when done right. And I think that's a lot of where it's again, do you own or partner? Big piece of it. And when you look at where the opportunities lie, especially on the affordability side, it can really work out well. So Ryan, do we have any questions coming in?
We have some great questions, Joe. Thank you. I think the first one I'll direct to Tana. You mentioned expectation setting and getting to know your residents. So can you tell us maybe a little bit more about establishing realistic expectations for both residents and families in a middle market product that may include fewer services, amenities, and healthcare oversight?
Yeah, I think that the first thing to remember, which has been a hard thing for me to kind of get through to my current teams, is we're not going after necessarily that same person that lives in a traditional retirement community today. And so it's not like we're taking away from what they've gone to see in another retirement community. You're going after that person who is, I like to think of it as, when I'm working with my sales teams, is maybe a widow or not married, which was a data point that you had, who is lonely, who's maybe not eating all that well, and what she looks forward to mostly in a week is going to the senior center to play bingo twice a week. That's who I'm going after. So when we have her come to our building, we're not telling her what we're not giving her. We're telling her all the things we're enhancing her life with. And so it's a little bit different take on what I think is going to be a challenge, is getting people to understand this is a different market. Those people we've talked about aren't the people that are moving into a traditional retirement community necessarily. So I don't know if that answers that question, but that's certainly how we're managing that expectation. They're super thrilled about what we're going to give them. We're not taking stuff away. We're enhancing them.
That's a great approach. Thank you. Pilar, I'll direct this next one to you. So can you speak a bit about how you're working to subsidize this sort of senior housing? What federal and state mechanisms or programs are you taking advantage of to support this population?
That's a great question.
So I have done new development, low-income housing tax credits with a developer that was specialized in that. So that's an avenue in terms of development. I have worked with all subsidies that are available. So I have helped. So the resident has a payment to make, and I go, okay, so how can we make you whole? So sometimes it's a rental subsidy. I've been a Section 8 landlord and subsidized rents with Section 8. And then I subsidize services through the Medicaid program, through Medicaid waivers. And then obviously there's the Veterans Administration has aid in attendance. So these are subsidies that I typically use. And the resident always has a responsibility to pay. So they're paying a portion, typically their Social Security check, some pension, and families can make contributions in the state of Florida, even if they are using the Medicaid program. So if there's anything more than that, let me know.
Ryan, I just wanted to jump in with a follow-up question kind of related to that subject. And we were talking about this earlier, was looking at the iSNP. What kind of considerations have you had? I know this is not something you've done before, but Tana, have you approached that and looking at the iSNP model as something to incorporate into your communities?
We haven't. Again, I would answer that kind of with a not yet. It was pretty heavy lifting during a pandemic to roll out the operating model. So those are all things that we think we'll be looking at next. We haven't done it yet.
We're definitely looking at the Medicare Advantage plans for our Medicaid residents. We will be starting that in January.
Okay. So, and when we talked about the iSNPs and looking at those opportunities, and also when I asked the question about servicing your own residents with your own owned service lines, what I keep hearing is opportunity. And looking at this population growing, looking at just down the road for the number of years that this can continue to evolve and build and grow, still seeing more and more and more opportunity. So I love the not yet, because I think it's, we've done so much in the seniors housing and the healthcare space. So to know that there's still a runway ahead of us for opportunity for growth to service this population that has significant needs and the income to be able to afford it, and the resources or the subsidies that are available, I think is a really exciting opportunity for our industry as a whole.
Indeed.
Excellent. Ryan, any other?
Yeah, I've got a couple more. I see we've got a few minutes left. I'm going to try to blend two questions in here. So the current models you've both described and are executing are within the existing policy structure as it exists today. What are the key policy changes you want to see that would drive increased feasibility or increased adoption of the middle market operating models? And I'll add onto this maybe a part two specific to memory care services for low income or middle class, because those costs are obviously really difficult to reduce.
We are still trying to serve the memory care market. I know that's something that maybe you're not, because a lot of our communities do have that memory care built in. I would say that part is definitely more challenging than the light acuity assisted living. So we're utilizing all the things we've talked about before on efficiency in labor, looking at every single line item, et cetera, and then trying to serve as many folks as we can in memory care. But again, if they become too much care for us, we may have to have them move out. As for policy changes, I don't know how to answer that one.
I mean, the thing that I think of is something that's come up for us is changing regulations so that our med techs can do more of what a nurse does.
Yep.
That's great for us. So those would be policy changes that we'd like to see continue.
Yep.
So that we can continue with the staff that is less costly to us in the operation, but still allow us to deliver the service. So I would say, right off the top of my head, that was one that
and I would say too, working with our states that we're in to ensure that they're not bringing in ratios. That can really hurt an operation, is if you have to have a certain number of people, regardless of your physical plant or what you've got or who you've got working for you. So that's just at that local level, really making sure that we're kind of staying away from what I see in skilled and keep with what we've got in assisted living.
And obviously higher reimbursements for Medicaid would be great too.
Right, yes, always, for sure.
That's great. So this is a really interesting question, one that might even speak to a bigger potential market than we've even shown here. But are there any portion of your residents that are not middle income, but are the more frugal, affluent type?
Yep.
Absolutely.
Yeah, we've regularly attracted that population that wants to save their money.
So not necessarily looking at a spend down, but they're going to be spending it for as long as possible.
Want to give to their kids, leave something behind.
I
They've
think
been frugal their whole life, right?
Yeah, we've all had those residents that, or prospective residents that walk into our traditional communities now and go, oh, this is too much for me. And so that's the person we're trying to attract. And I have to say, it's not a lot different than how I am. I don't want anybody to carry my suitcase to the room for me in a hotel. I'm fine carrying it myself. It's on wheels. It's not a big deal. That it's just really that more practical approach.
Yeah.
And I think there's a lot of them out there. I mean, they live with us now. We're just going to create a more comfortable environment for them, where I think they also, they're typically the person that wants more control in their life, and we're going to give it to them.
That's right.
That's great. Well, we are just out of time, so I'm going to wrap it up. I cannot thank you both enough, and Ryan, thank you for presenting the study and the data so well. I know I learned a lot. This is not a market that we are in, but after being here today and sitting along with you, it is a market I want to be in. So we're gonna figure that out. I hope that the audience is going to walk away with a true understanding of what this middle market looks like, and maybe next fall we'll be talking about the middle market without the word forgotten in it. Thank you again for your expertise and for sharing it with us. Everybody, thank you so much.